Good evening. Glad you're with us tonight. I'm Brandon Bartlett.
And I'm Shelley Kirk. Hospitals across Kentucky are bracing for big funding cuts to Medicaid after Congress passed changes supported by President Trump.
Owensboro Health says that 1 in 3 Kentuckians use Medicaid. Leaders warn it could shut down programs that thousands rely on and even force some rural hospitals to close.
Eyewitness News' Cindy Davis has more from the Kentucky Hospital Association.
Our payments are going to be cut back over a 10-year period from today, $2.4 billion. And at the end of the 10-year period, it will be $235 million, which is a 90% reduction, which is essentially taking the payments away.
For many Kentucky families, Medicaid is the only way they can see a doctor, get mental health care, and even afford treatments that mean the difference between life and death. A recent proposed bill by President Trump would reduce funding drastically, leaving 11.8 million Americans at risk of losing their health coverage. The Kentucky Hospital Association argues the change could result in hospital shutdowns.
Many of our urban hospitals are 70% government patients, but when you get in some of these rural areas, it could be 80-90% government patients. They're still having to treat the patients. They're still having the cost of their staff and the services and the supplies. That hasn't changed.
Dozens of organizations' signatures were added to a letter expressing to leaders the importance of payments coming to hospitals, including Owensboro's River Valley Behavioral Health and Owensboro Health.
Really, every hospital in Kentucky, along with KHA, to our House members, encouraging them to continue to work to get the House provisions in the final legislation.
RVBH treats thousands of patients every year for mental health and addiction. They credit Medicaid-funded services as the foundation of recovery, helping children stay in school, keeping adults in the workforce, and holding families together. Owensboro Health argues the change could harm access to care for all patients, not just those covered by Medicaid.
If you have insurance, be it Medicaid, Medicare, whatever, and you can have coverage, but if you don't have any place to get the service, it's like having a cut in your benefits.
Officials say the change could be implemented as soon as January 2028. And facilities have already begun planning for what services will look like if no adjustments are made to reduce the severity of the cuts. Galvani says there's a way the public can help while KHA continues the fight.
Help us by letting their members of Congress know that they need their local hospitals and that the cuts went too far.
Sydney Davis, Eyewitness News.